Alrighty, we will go ahead and get started for today. Welcome to our Missouri Open Door Benefit Series for June. My name is Angelina Alpert, and I am a research assistant at University of Missouri Kansas City Institute for Human Development. And today we are going to be talking about the Missouri Long-Term Care Ombudsman. For any of you who may be new to the benefit series, all of these are recorded and posted on the Charting the Life course YouTube. If you are interested in viewing any previous months or are looking to go back to this one afterwards, they are also sent out in a follow-up email afterwards as well. Once you have signed up for the series, you will be automatically added to that list. Also, if you have any questions throughout the presentation, feel free to go ahead and put them in the chat and we will get to them at the end. So, the benefit series is sponsored by Medicare Improvements for Patients and Providers Act, also known as MIPA, priorities 1, 2, and 3. So, priority 1 is Missouri SHIP, the State Health Insurance Assistance Program. Priority 2 is the Missouri Department of Health and Senior Services on behalf of the AAAs. And then priority 3 is the Institute for Human Development as the No Wrong Door designee for the state of Missouri. So a little bit about Missouri No Wrong Door is that it aims to transform the way people access services in the community. And it does that by supporting individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports, regardless of their age, income, or disability. So the goal of this series is to open doors to integrated supports. If you are unfamiliar with Charting the Life course, this is our integrated support star. We aim to have people use different types of services and supports that are integrated throughout their life. That way they are able to participate in the family and the community of their choosing. And so our integrated support star has 5 different types of services and supports, which are personal strengths and assets. So skills, things that a person is good at, personal belongings and resources, relationships, whether that's family, friends, acquaintances, neighbors, eligibility specific, which are needs-based services, whether it be on age, geography, income, those government paid services that are specific to a disability or diagnosis, which those eligibility specific services are what we talk about in this benefit series. And we also have community-based services and supports, which are going to be things within the community that anybody would have access to, whether it's businesses, parks, schools, groups, or membership organizations. And then lastly, we have technology, which is personal technology, assistive or adaptive or environmental technology, which we have a series on as well. So before I pass it over to our presenter today, just wanted to toss up the series schedule for the rest of the year. So our benefit series are going to be on the second Wednesday of every month from 12:30 to 1:30. Our next one is going to be on July 9th, and that's going to be about aging caregivers and family supports. And then our technology series is the fourth Wednesday of every month from 12:30 to 1:30, and our next one is going to be on June 25th, and that's going to talk about digital safety. And I will toss all of those links in the chat for anybody interested. And with that, I will pass it over to Lindsay.
Hello, my name is Lindsay and I'm with the Long-Term Care Ombudsman Program. Today we are all wearing purple with Department of Health and Senior Services. We are taking the day to celebrate the June 15th World Elder Abuse Day. So hopefully all of you will be able to be involved in some way with that initiative this year. like I said, I am with the Long-Term Care Ombudsman Program. My title is the Deputy State Long-Term Care Ombudsman, and Jenny Hollinsworth is our State Long-Term Care Ombudsman who oversees our program. If you could advance the slide, please. So you may be thinking, Ombud what? We get lots of comments and complaints about the name. Our name is in federal regulation, so there is not the opportunity to change that, but it is a Swedish word, and it does mean to be able to speak on the behalf of someone. So that's what we do. We really focus on providing advocacy for our residents in nursing homes, education. We also work with empowering our residents so that when we're not there in the buildings visiting with them, they know what to do when they have concerns. Next, please. All right, so then when looking at what we do as a program, just a little bit of kind of data for you. Back in September of 2024, at that point, we had 607 assisted living and residential care homes, which equaled over 27,000 beds. There were 502 intermediate care or skilled nursing facility homes with over 52,000 beds. And then we also cover VA homes, which there are 7 of those throughout the state with over 1,400 beds. So we do have a lot of residents that are depending on us and that we work with as far as trying to get around the facilities to visit with them. We are very much a resident directed program, which means that our residents let us know what they want and how they want us to go about getting the things that they need. So it's a little bit more than being resident centered, because we do take our direction from the residents. We're not allowed to do anything without their permission first. But through the Older Americans Act and the Ombudsman Final Rule, some of the things that they have outlined that are tasks that our ombudsmen perform while doing their visits is that we do identify, investigate, and resolve complaints. So whenever we receive a complaint, whether that's from families, community members, friends, or the resident, we will take that through our intake and then partner up with the resident to find out if they agree with those complaints, and then proceed with the investigation with the goal of resolving the complaints to the resident's satisfaction. We also provide a lot of education to residents and to families, members of the community, and nursing homes. We also provide technical support to our resident councils and family councils across the state. Most facilities do have a resident council. We have a few family councils across the state. Most of the time when we're working with family councils, it's because there's a group of families that are wanting to start up a council. So we will help them with that. We also advocate for change to improve residents' quality of life and care. We can represent resident interests before governmental agencies. We can also seek legal, administrative, or other remedies to protect residents. And then we ensure that the residents have regular and timely access, and that we do those by trying to be in the homes as often as we can to seek out concerns and build that rapport with our residents. Next, please. So just some examples of some common complaints that we receive. We do receive a lot of transfer discharge complaints, and those are going to be whenever a facility initiates the discharge of a resident to another facility. And a lot of times this is because the residents have exhibited what the facility calls difficult behaviors, and they don't feel like they're able to resolve those issues. So we often help residents with filing appeals for appeal hearings, because the residents do have the right to appeal those discharges. And we provide a lot of education to the facilities as well, because there's a lot to those regulations and there's a lot of turnover with staff. We also get a lot of calls about guardianships or responsible party complaints. Sometimes the residents aren't happy with the decisions that the guardian or their responsible party is making for them. So sometimes we're able to help kind of walk them through the process and provide education. We can also, if the resident wants it, we can assist them with contacting the court if needed to request a new guardian. We also get a lot of calls about not receiving adequate care, and that can be anything from not receiving their showers routinely, call lights not being answered timely, medications being late, or maybe not at the time of day that they're used to. Assistance with toileting is also a problem at times. And a lot of these issues all kind of roll back to low staffing. And a lot of the nursing homes are having issues with having enough staff to care for those residents. And then food, we get a lot of complaints about food, and could be that the food doesn't taste well, that the foods that should be hot are not hot, not offering substitutions, or not providing adequate nutrition. Sometimes we'll find that there may be a facility that's also having issues with staffing their dietary department, so they may be having a lot of sandwiches with chips, and that gets old very quickly, and doesn't meet a lot of diet requirements for our residents. Next slide, please. So this kind of just goes a little bit through kind of what we do and how we're different from some of our other state counterparts that investigate complaints. So we are not licensed and regulatory agency. We do not do inspections or investigations from the standpoint of finding a facility at fault with those regulations. So we are not the same as our surveyors that go into homes to look at making sure that they are meeting the regulations. We're also not protective services and adult protective services investigators. We provide a lot of education, and we can investigate complaints, but our investigations are not going to be fact-finding investigations. We're not going to be looking at whether there was a wrong committed and whether someone should be in trouble. What we're going to be looking at is trying to resolve the issue so the resident is safe and doesn't have the concerns that they may have with their quality of care or quality of life. And then we don't provide direct care for residents. So we're also, when we're in there visiting with residents, we're not going to help them to the bathroom. We're not going to help them get drinks of water. We can help staff attend to those needs, but we will not be the one actually providing that direct care service. Next slide, please. So some different benefits of the program. We really do help increase the resident satisfaction within their home. A lot of times the homes do kind of look at us as being a threat because we are bringing them concerns that their residents have. But if the residents are happy, it becomes it's a more pleasurable place for the staff to work as well, which is why you also see an increase in staff satisfaction, and then also increased resident quality of life. We a lot of times will notify administration in the facility of issues that they may not be aware of that are happening. And so if they're able to fix those and resolve those before they get in trouble, as they like to refer to, that still helps the residents if they're able to fix those issues and keep those from coming back and providing that good, satisfactory care. Next slide, please. So this is our long-term care bed and service availability portal. We have this out on our website. We developed this to help with some residents that may need placement from a nursing home or from a hospital setting that may have advanced needs as far as like wound care or bariatric care. We also have information from the facilities about who has locked units and different things that a resident may be needing. We also utilize this whenever we have facility closures across the state. We may have a facility that has a lot of residents that live there, but they're not going to be open much longer. And so we're able to use this to try to find appropriate beds that are available to provide the level of care that the residents are needing. So this is out on our website, and at any time anybody can look at this. The facilities update this themselves, so the information is from them about what care they have and what beds they have available. And then I talked a little bit earlier about some of the advocacy and legislative work that we do. We do systems advocacy. And systems advocacy can be on a small scale within a facility if there's a group of residents that have needs that are not being met, or it can be on a larger scale, maybe within a corporation of nursing homes where there's a specific need or policy that the residents are upset about. But we can also work with our legislatures. And so we do an advocacy day every spring, usually somewhere between January and March, where we will go out and meet with the representatives and senators to let them know about issues that are important to our nursing home residents. And then this slide shows our map and where our different regions are. We at the state office provide the oversight for the program, but it's our regional offices that are actually doing the foot on the ground work, so to speak, and providing that service to our residents. We have about 17 and a half fully staffed, we have about 17 and a half FTEs in order to provide services to our residents, but then we have 62 volunteers currently that are designated to provide ombudsman services across the state. Our volunteers do a tremendous amount of work for us. They do a lot of education in order to be able to perform the duties, but then they also spend a lot of time in the homes visiting with the residents, finding out what their concerns are, and then also being able to provide resolution for those concerns as well. And then we also have a Facebook page, Missouri Long-Term Care Ombudsman Program. So if you would like to like our page, we share lots of tip sheets and information that's good for advocating for a resident, lots of good and great family information as well. But that's kind of in a nutshell what we do. We are the primary organization that advocates directly for the nursing home residents, whether that's skilled, assisted living, residential care, or in the VA system. So does anybody have any questions?
You can feel free to either put questions in the chat, or you can go ahead and raise your hand and I can unmute you. Either way will be good.
One thing that I should mention is that there isn't any cost to using this program. This is something that's primarily federally funded. There are some state funds, but there is no charge to utilizing our services. So we are free for everyone.
While we're waiting for questions to come in, I'm going to go ahead and stop the share just for a second so I can get the links in the chat. I see you have your hand raised.
I was a little confused about where I would go to contact the AAA, or you had one other?
You could either contact us at the state office and we can direct you to the regional office, depending on where the nursing home is located, would depend if it's a AAA, or we do also have some agencies that are contracted, and it was on the map, the different breakout as far as counties. But a lot of people just call us at our state office directly, and then we can direct you to the correct region. And I see that our 1-800 number is now in the chat. So if you
Okay.
want to reach out to us, we can connect you with the right person to talk with. We'd be happy to do that. You're welcome.
Okay, while we go ahead and see if there are any other questions that come in, I did just want to share a couple other opportunities while everyone is here. I am sending a link in the chat to a PDF from Missouri SHIP. Again, that's the State Health Insurance Assistance Program. They have their June online education offerings. There is one later this afternoon from 2 to 3 p.m. About volunteer opportunities for Missouri SHIP. And then tomorrow, June 12th, from 10 to 12, is a retirement roadmap session. We shared one of these earlier in the year, and people were super excited about this opportunity. So wanted to make sure that you all knew about that. And then there are a couple other opportunities in there as well for the rest of the month, and those will be sent out in our follow-up email as well. Um, and it doesn't look like we have any other questions. So thank you all for joining us today, and we look forward to seeing you next time. And thank you, Lindsay.
You're welcome. Thank you for having us.